Good evening, ladies and gentlemen. A warm welcome to all the distinguished guests, practitioners, students, and members of homeopathic fraternity. On behalf of Homeopathic Medical Association of Telangana, myself, Dr. Sai Shruti, Joint Secretary of the association, feel privileged to welcome you all to Nyapati Venkata Srinivas Rao Memorial Oration. We are gathered today to honor the legacy of our distinguished physician whose contributions continue to inspire generations of homeopathic practitioners. I now respectfully invite our esteemed dignitaries onto Dr. G. Durga Prasad Rao Garu, General Secretary, HMAT. Dr. Akansha Reddy Ma'am, our esteemed speaker. Dr. Gautam Ralabandi Sir, our esteemed speaker. As a mark of respect and gratitude, I now request all the dignitaries on the dais to offer floral tributes to the portrait of late Dr. N.V. Srinivas Rao Garu. Thank you, sirs and ma'am. To formally welcome the gathering, I now invite Dr. K. Gopal Krishna Sir, President of our association, to deliver the welcome address.
Good evening, ladies and gentlemen. A distinguished guest of this evening, Dr. Akanksha Reddy Garu, and our beloved General Secretary, Dr. Durga Prasad Garu, and distinguished another speaker, our own friend, Dr. Gautam Rallabandi, and our Vice President, Dr. Manik Prabhu, and our executive member, Dr. Kalpana, and all the audience, guests, and friends. A hearty, warm welcome to you all. Today we are organizing Sri Nyayapati Venkata Srinivas Rao Memorial Oration. Nyayapati Venkata Srinivas Rao Memorial Oration was instituted by his own children, Sri Ramarao Garu and Sri Krishna Rao Garu. So, a family of homeopaths. So, on this occasion, we pay our heartful homage to Nyayapati Venkata Srinivas Rao Garu, and we also extend heartful thanks to the family of Nyayapati Venkata Srinivas Rao Garu for sponsoring this event. Nyayapati Venkata Srinivas Rao Garu is in fact a pioneer in homeopathic system of medicine in our state. So undivided Andhra Pradesh. So he was the first person to establish homeopathic pharmacy. So initially in Tenali, later he shifted to Vijayawada and then to Hyderabad. So Ramakrishna homeopathic stores and later they also started pharmaceuticals. So Nyayapati Venkata Srinivas Rao was a student of Lanka Ramarao Garu of Kakinada. So he learned homeopathy from him. He got diploma and later he established homeopathic pharmacy. So in those days, homeopathy was not much popular, not much known to people. So he wanted to introduce this system of medicine to the people of Andhra Pradesh. So he put a lot of efforts in promoting homeopathy and introducing homeopathy to people because they were not aware of it. So they were totally strange to it. So he pursued each individual and each person who visited his premises. So that's how we owe a great lot to that personality. And we once again pay our homage to him. So later he moved Ramakrishna Homeo stores from Tenali to Vijayawada. So in Vijayawada, it got popularized. It was a developed to situation. And later he moved to the state capital, Hyderabad. And in Hyderabad, so Ramakrishna Homeopathic stores was very popular. So initial days of homeopathy in Hyderabad. So only RHS, Ramakrishna Homeopathy stores was available. Later Sagar Homeo stores started. And Ramakrishna Homeopathy stores, apart from stores, they also started a pharmacy. So Ramakrishna Pharmaceuticals. So one son, Dr. Krishna Rao was taking care of pharmaceuticals. Ramarao Garu was taking care of these homeopathic stores. So they both, and Krishna Rao Garu started the Jayasuri Homeopathic Medical College later. So this family had rendered great service to homeopathy. So all of them owe a great lot from our side. So later, our beloved friend, a grandson of Venkata Srinivas Rao, Dr. N. Srinivas Rao. So he also started practicing in Ramakrishna Homeo stores. Later, he became a central council member and he worked hard to develop homeopathy in capacity of central council member. So on this occasion, we extend our heartfelt thanks to the family of Nyayapati Venkata Srinivas Rao. And today we have a very distinguished speaker from Bangalore, Dr. Akanksha Reddy. So her topic is reclaiming identity through constitutional homeopathy. So she is a popular practitioner in Bangalore. practicing for the last 15 years. So we will be hearing from her about her experiences in treating few of the skin ailments. And we also have another popular practitioner, our good friend, Dr. Gautam Ralabandi, who would be talking about clinical insights of lesser known homeopathic remedies. So hope we will be immensely benefited by hearing them. Thank you. Thank you once again.
Thank you, sir, for your warm and inspiring words of welcome. To share with us the vision, activities, and achievements of Homeopathic Medical Association of Telangana, I now invite Dr. G. Durga Prasad Rao, sir, General Secretary of our association, to come on to the dais.
Respected President Dr. Gopal Vishnu sir, our beloved speaker, the daughter of Hyderabad and the daughter-in-law of the Dr. Akan Reddy, and her beloved husband, Dr. Ishfaq Reddy, and another speaker, Dr. Gautam Ralabandi, our student Manik Prabhu, and member of Honorary Physician Committee, and our Joint Secretary. Today, on behalf of the Medical Association of Telangana, I pay my heartiest tribute to our Master Dr. Shamil Hanuman and also Sri Hmat who have gathered here to conduct the oration in his name. And six years Dr. Shiva multi-charitable dispensary, charity books on particular institutions opportunity. So, Sunday, last Sunday, conducted auditions for the 4 decades, not 4 decades. Also, we conduct our CME programs at the various Telangana. Also, so all these activities thank our church supporters for working with us and support for every time. Thank you, thank our speakers, Vasanth Reddy, all coming from those who lively in opposition to carry over some legal situation. She came to the picture here. Thank you, madam. Unprecedented, I requested the before only thank you, Gautam. Thank you all. Thank you.
Thank you, sir, for highlighting the remarkable work of HMAT. We now begin the first academic session of today's memorial oration. It is my pleasure to invite Dr. Chamundeshwari, Organizing Secretary of our association, to introduce our first speaker, Dr. Akansha Reddy ma'am. Good evening, one and all. So, the speaker of our first oration is Dr. Akansha Reddy ma'am, who is a senior homeopathic physician with more than 14 plus years of clinical expertise.
And ma'am has a clear expertise in chronic disease management, autoimmune disorders, cancer supportive treatment, classical homeopathy, case taking remedy selection, and patient counseling. Along with many of her achievements, she is not only a homeopathic physician but also a philanthropist and an NGO supporting for child and women healthcare, which is a great initiative, ma'am. It is a great pleasure that you have been here. And ma'am also holds degree in SCPH, SCPH Plus, and advanced certifications in homeopathy. Along with this, ma'am has conducted many CME programs, medical sessions for doctors, and a great welcome for our association. And thank you for gracing our event for your wonderful knowledge. Please give a big round of applause for the first speaker of today's session. Just say hello. Hello. Then namaste. Yeah, that should be fine. Is it audible? On to. Hello. Hello. Yeah. You want to change your side. Button. Oh, no, that should be. Hello. 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 Good evening. Yes, it's audible. Good evening, everyone. Thank you, Hmat, Sir Dr. Gopal Krishna sir and Dr. Durga Prasad sir. Good evening, and thank you so much for giving me this opportunity. I'm really thankful. And start the session, sir. So we'll start our salutations with Dr. Samuel Hahnemann. Definitely, without whom we would have not started, or we have been not over here. So my salutations, my venerations to Dr. Samuel Hahnemann. Yeah. So myself, I would like to introduce myself again. I am Dr. Akanksha Reddy from Nama Homeopathy, Bangalore. I finished my homeopathy from HKS Homeopathic Medical College, MD from there. And I've been practicing in Bangalore since last 15 years. So it's a where a lot of juniors have been over with me over training, learning. We have been juniors. So we have learned through a lot of experience. I'll share few of my best cases where we have seen homeopathy as a magic. Yes. So I have taken the topic as hiding healed. This specially contains about reclaiming patient identity through constitutional homeopathic medicines. So the case starts as it is a 15-year-old female student, Hindu by religion and middle class by status. So there is an extensive psoriatic eruption since 10 years. Yeah. So the patient has been having severe itching. You know, everyone has a homeopathy that the psoriasis is a very chronic disease, and there have been a lot of complaints, especially like itching, dry skin lesions, bleeding after scratching, cracks, fissures. and irregular menstrual cycles and emotional withdrawal. So this was the case when the patient entered into my clinic. So this girl is now 19 years, but she has been experiencing these conditions from last 10 years. So from the age of 9, she has been suffering with this condition. So there was an extensive psoriatic complaints we can see. So the patient was apparently healthy up to 9 years of age. And then there was a start, as we everyone know, that there was a very small patch over her, which has been increasing, and it was almost ignored by the family for months and years together. And as we all have been knowing this, that usually never a skin complaint or even any cold or conditions also, we see a patient directly coming to a homeopathy until unless we have a homeopathy in the family. So the patient has been through a lot of treatments. She has been into lot of moisturizers as they start then topical applications. They have been seeing. Then this patient has lesions which were thick, dry, scaly, intensively itching. Every scratch was bleeding. Winters were very much painful, and cracks and fissures. Nights became unbearable. The father attended along with the patient to the clinic. He was saying that whenever in the morning we see the patient bedsheet used to be a little bleeding because that was a very severe bad condition she was experiencing from so many days, which was definitely emotionally exhausting her because it was a teenage mind. It started as a smaller patch. It is going on increasing, and the girl has been suffering from this condition. So the child who was very much playful, expressive, has become detached, emotionally withdrawn, stopped attending gatherings, stopped wearing clothes she liked, stopped sitting to close people, stopped looking into the mirrors. She was described as dirty and different from everyone else. Definitely, there was a lot of distinct conditions which were very much painful to her. As we everyone know that topical steroid applications, shampoos, moisturizers, oral medications were given. This patient, his father, when he was narrating, and the patient when he came, she was saying that she has attended all the allopathic clinics in and around the place, all the Ayurvedic conditions. She has been into many herbal paste, herbal lotions, and all that. And when she was narrating few of the rituals what she has attended, which was quite unbearable to hear, like she was taken to few of the temples where she was made that bath in the wells, which was very much painful to her. And there are few temples. She was saying in Tamil Nadu at some place where they feel that it has been bewitched. ఏమో దయ్యం పట్టిందేమో చూసి వాళ్ళకి they have given her a lot of physical torture, like hitting her, trying to give a lot of exposures to just, it was like parents were very much desperate to get the child cured. That was the only condition, but the child was definitely going into lot of withdrawal, social awareness, isolation conditions. So temporary suppression was achieved, but every relapse was more aggressive and conditions were worsening, which has pushed the patient to several painful and irrational traditional practices. So they have been into a lot of practices where they were irritating herbal paste, oil-based applications with intense burning. And there were restrictive food rituals also, like you are aversion to milk, you are aversion to this food. So there was already trauma to her. Already she was suffering from psoriasis with such a painful condition, and the treatment what she was receiving also was quite traumatic then. Instead, that the child was enduring all this just to see folks in her parents, and she started disconnecting from the world. So along with the psoriasis, she was also having irregular menstrual cycle. She was saying that there is a bearing down sensation. Chala కడుపు నొప్పి ఉంటుంది. It is in Kannada. చాలా సరే నేను అసలు కూర్చోలేను నిలవలేను అనిపిస్తుంది మేడం మెన్సెస్ టైం అనేసి షెట్ యూస్ టు ఆల్వేస్ కంప్లైంట్ అబౌట్ ఇట్. సో విత్ దిస్ కండిషన్ with few of the mental genders like desire to remain alone, emotional indifference towards family, aversion to consolation, silent brooding, embarrassment, aversion. She was very answering softly, briefly, avoiding the eye contact. Through chronic illness, we have seen her lesions deep, which are not only over the scars, but also over the mind also. She was going very much weaker. She was chilly, easily exhausted, desires spicy and sour food, aversion to milk, disturbed sleep due to itching and weakness during menstruation. So as we know, everyone, psoriasis is a chronic inflammatory autoimmune disorder involving dysregulated T cells mediated immune response resulting in hyperpigmentation of keratinocytes. It is both epidermis and dermis which has been affected in psoriasis, and it is accelerated epidermis turnover, chronic dermal inflammation, cytokine-mediated inflammatory cascade. Psychological stress is recognized as a major trigger and maintaining factor. In this patient, prolonged emotional suppression, isolation, chronic mental stress, and hormone imbalance appear strongly associated with recurrent disease activity. So the epidermis, dermis, both are affected, and psoriasis condition scales, inflamed plaque we have seen. So psoriatic features was intense itching, dryness, functional disturbances, and emotional sensitivity. And syphilitic was chronicity because she was suffering from last 10 years, recurrent tendency, hyperproliferative pathology. Desire to solitude, emotional indifference, irritability, grief, aversion to consolation, and low of confidence. Chilly, weakness during menses, desire spicy and sour food, easily exhausted. These are the particular symptoms: irregular menses, painful menses, bearing down sensations. So with the characterization, I have taken psoriasis, chronic, quality pain, dragging, bearing down menses during, and complete indifference. Due to the condition, patient was prescribed Satya. After Satya, the patient has responded very beautifully to the remedy given. As everyone knows, Satya is a deep constitutional remedy which is going to help. So the remedy recovered the patient at mental level, hormonal level, physical, general, skin pathology, and asthmatic background. Single constitutional dose was prescribed on totality and susceptibility. Placebo was prescribed follow-up during. First month, reduction in itching, better sleep, feeling reduced, emotional calmness improved. So this was after first month itself, after 200 Satya dose, the patient was doing the improved with this condition. The smile has again come back to the patient. She was able to feel better now. Significant reduction in next month, cracks healed, menstrual pain reduced, emotional responsiveness increased. Second month, this was the response. Flattening of the lesions, few minimal eruptions, increased confidence at better energy levels. So by third to fourth month, we can see there is a complete betterment of the patient. All her menstrual cycles were better. She was physically, mentally, emotionally. There was a marked improvement. She was not now physically, just mentally also she has improved. Her cycles improved. Her social interaction and normal activities also has improved. So there is the condition has improved from this to this. Thank you so much. So the case illustrates that chronic psoriasis we can evolve a dermatological disorder which has psychosomatic illness, identity, emotions, confidence, and social pressure functioning. Patient has undergone years of suppressive and painful treatments that addressed only external lesions while deeper emotional suffering continued unchecked. With constitutional homeopathic medicines, the patient is not only just the skin but the whole as well. She has been better. Patient got later married. She was really very happy. The patient who thought that there should be isolation, aversion to company, not interacting. Thought of marriage was also like very far because her skin conditions were such a painful. Later she has doing healthy in her marriage life. So as we know, the functions of skin is protection, sensation, thermoregulation, control of evaporation, storage, and synthesis, absorption of skin, water resistance, and camouflage. Conflicts associated with dermis are attack conflict, which can be physical injury, medical procedures, needle biopsy, injection, vaccination, water injury, sexual remarks, feeling soiled and dirty. So again, we have an introduction about psoriasis because many of my cases are related to skin. So psoriasis is a chronic inflammatory autoimmune dermatitis characterized by hyperproliferation of epidermal cells leading to erythematous scale plaques. Fissures, itching, and recurrent relapses. Emotional shock, fright, and suppressed trauma are recognized as important maintaining causes in chronic psychosomatic diseases. So this is also a case of emotional suppression, insensibility following trauma has been successfully treated. So this is a case of a female 25 years old physical training teacher. She is an unmarried girl. She is also having complaint of psoriasis from last 12 to 13 years. So she is 25 from 12 to 13 years. She is suffering. So around her teenage, this girl has started with the psoriasis, which are thick, scaly eruptions, redness, painful bleeding, cracks, dryness, and severe itching. Affected areas are face, upper and lower lips, duration is since teenage. So this was the condition. Patient has been taking a lot of treatment. As explained, 12 to 13 years, teenage, the patient has started with psoriasis. So there is different, every time the patient has different complaints during every moment, like sometimes there is dryness, sometimes there is scaliness, sometimes there is redness, sometimes there is itching. So every time the patient has been with different signs and symptoms. So she was also very much healthy up to her adolescence till her teenage. Later, over her lifetime, the psoriatic patches have started, which has been spreading through her body. So lesions that became progressively dry, thick, scaly, painful, fissured, bleeding, as it has been prolonged treatment. Definitely, as explained, as known, the other homeopathic physicians, we have known that patients don't come as directly. They are taken homeopathic steroid treatment, Ayurvedic treatment, multiple homeopathic treatments also, the patient has been taken. This patient came to my center for treatment where she was treated with various doctors even. She was getting treatment for three months under a doctor. We have a chain of clinics, so in our clinic we have 5 to 6 physicians along with us. So every 3 months the doctor was changed because she was suffering so much, the doctors were not able to handle her. So every time she wanted relief, she was pestered. And she is a great patient, I could say, because she is highly loquacious, highly manipulative. Every time you give, even a junior doctor, he starts taking the case, she can give a case up to an hour and 2 hours. Like how it started, how it is spreading, how many treatments she has taken, how painful she is going. And when you ask about her mental conditions, she used to say that she was in relationship with a fellow kind of in her, the boys used to be behind her. She was how she was manipulating her parents and going along with the band. And she was behaving. She was so much to give. What the There's always a confusion because so much things were, homeopathy feels very happy when there is so much to know, but we have to pick up the perfect one. That was the case. So she was almost in my center itself for an year and two, where she was getting treatment with every doctor for 3 months. So because of lot of confusing and abundance and superficial symptoms, so she was extremely loquacious, talkative continuously, excitable conversations. Every time she could create a story, every time she would say that, ma'am, I have been a physical teacher, so I have been in a relationship with another physical teacher. I mean to say she was like flattering desires. She used to talk, she used to do, she used to come. So she was in a dramatic way narrating complaints and shameless behavior. And emotionally. Suddenly one day she would come to the follow-up and she will, even if a junior doctor is sitting beside, even if a male doctor, even if father was accompanying her during the session of treatment, she used to put her hands and show us like, ఇల్లా అయితే she was ఇక్కడ అంతా అయింది వెనకాల అయింది ముందు అయింది అనేసి she used to keep on, so she was so much to us. She had no inhibition at all. So she has multiple romantic relationships, deceiving parents, skipping classes, wandering with boyfriends, personal and sexual matters, religious discussions. Suddenly one day she used to come and say, ma'am, I go nearby temple to my home, where I pray to God, where I do decoration to God, where I make the sari to the goddesses. And everything is there in her. It was very confusing. So whenever I was asking her with so much of painful conditions where there were cracks, there were bleeding, there was itching, there was lesions and all that. And I used to ask her, money hingi anino, money etla unnavu, madam chala baagunnanu. ఇంత painful condition లో కూడా అక్కడ ఎట్లా చెప్పగలరు బాగున్నాను అనేసి. This was very striking to me. How can one say that you are doing good when you are actually in so much of physical condition painful? So there was absence of emotional reaction, insensibility towards suffering, heinousness of mind despite several severe pathology and emotional numbness. Patient, how obstinate they can be in not giving the case. We as a homeopath should be more obstinate in getting the case. That's what they have learned from our gurus. So I felt I again retake her case. I have retaken her case. I said, today you have to say me what happened to you exactly. We will be again not like a doctor and a physician who has been meeting from last 6 months or 3 months. We will today sit as we have met today very first time. So when you were in your teenage, in your 12, 13 years, exactly what happened? What made you to get psoriasis? So this, she finally said that during her teenage, one of her cousins tried to physically abuse her by holding her right hand. So during her teenage, one of her cousins attempted physical abuse and forcefully grabbed her at her right hand. So this was the first psoriatic patch where she has started with. So this is the patch where the patient has been suffering, which the patient has never disclosed. About this physical and this abuse, the patient has not discussed with the parents, family members, and previous physicians, but she was giving a lot of case. She was like always the time loquacious and giving us a lot of case. So following the incident, patient gradually developed emotional dissociation, false cheerfulness, excessive talking, shameless outward behavior, and emotional insensibility. The suppressed shock appeared to be the maintaining cause of the chronic pathology. So extensive dryness, thick scales, bleeding, chronic itching, red inflamed eruptions, no marked cravings and aversions. Psoriatic features are intense itching, dryness, and scaling. Psychotic features are chronicity, hyperpigmentation, thickened lesions, concealed emotional state. Syphilitic features are bleeding, cracks, tissue destruction, and deep fissuring. So the psychological trauma and fright can alter hypothalamic pituitary adrenal axis regulation and create chronic inflammatory disease. So in this patient, there was a suppressed sexual trauma, emotional shock, internalized fear, dissociation, and insensibility appeared in chronic immunity, dependent skin pathology. The patient's peculiar state of emotional anesthesia, despite severe suffering, strongly reflected the opium. Opium 10 was prescribed with mental generals elements from fright, shock, insensibility, shamelessness, loquacity. Despite suffering was majorly the state what I have taken. Painlessness of the painful complaint. Skin eruption, psoriasis, scaling, cracks, bleeding, dryness, itching. So hyoscyamus was given many times repeatedly to the patient because she was having shamelessness, loquacity, but lacked emotional numbness and shock pathology. Stramonium had fight, that fear, shock, but there was more terror, violence, and fearfulness. Lactasis is loquacity, sexual things, but not characteristic, insensibility, and painlessness state. The painlessness state was very much prominent, which was covered by opium. Opium covers a central state completely, elements from fright, shock, emotional anesthesia, shamelessness, loquacity, painlessness despite pathology, hidden trauma with lack of reaction. So the final prescription was opium 10 mg single dose. Within 21 days, actually this was a very chronic case, but this has helped me a lot in learning that if you go to a particular case, when you recheck yourself that where you have done wrong, where you can do much more better, there is always a facade, there is always a psychosis which the patient doesn't want to say. So when you are adherent to curing the patient, when you retake the case taking again, you can cure and see the patient within 21 days. There was a great improvement in the patient. This redness was reduced, cracks were reduced, she started feeling much better. There was absolutely clean skin. Within 3 to 4 months, the patient has completely healed herself with the trauma what she was suffering from last 12 to 13 years. So how the suppressed trauma may manifest through chronic autoimmune disease. It is not just physical, it is how the trauma which we have been giving, but how the patient projected as confusing psychotic picture has to be ruled out. Excessive talking, shamelessness, dramatic narration, false emotional expression. But deeper exploration reveals shock, emotional suppression, dissociation, and insensibility. So the opium based on the deepest mental state rather than superficial expressions produced rapid improvement. Case emphasizes on importance of identifying hidden maintaining cause behind chronic pathology. As we know, Doric has said that Hahnemann says that it is much more difficult to estimate the action of opium than of almost any other drug. The effects of opium as shown in the insensibility of nervous system, the deep depression, drowsy, stupor, painlessness, the general sluggishness and the lack of reaction constitute the main indications of the drug when used homeopathically. All complaints are characterized as stupor, they are the painlessness. So again, in the we have seen this, that all complaints, there is painlessness of the complaints, which we can see in this patient. While externally the patient appears to be calm, euphoric, and even elated, internally there may be light, unresolved shock, grief, fear, and guilt that has never been fully expressed, never well since fright, being one of the keynote indications of opium. So these 2 cases we have seen, and another I have a case of male named Darun, who is 22 years old, who has been suffering from psoriasis from last 4 to 5 years, and it is only over the scalp. So whenever the patient entered, there was always continuous shedding of the fluids from the scalp and gradually worsened the emotional distress. So this was the condition. As usual, same multiple allopathic, Ayurvedic, temporary relief. Again, they have come to homeopathic for the last resort, the treatment. First, during the first consultation, he was, as it was very difficult for us to get the case. He was not saying anything openly. He was emotionally, mentally confused. He was chilly, not open. Then answered in circular, as everyone knows, so we all homeopaths know that ఏమైంది ఎందుకు స్టార్ట్ అయింది ఎప్పటి నుంచి స్టార్ట్ ఏముంటుంది మేడం అదే ఇప్పుడు నుంచి స్టార్ట్ అయింది 2 సంవత్సరాలు అయింది నొప్పున్నది అక్కడ ఇక్కడ ఇదే there is nothing like they what you want you don't come us to it directly there has to be always circle to get at the. So, but the severity of the pathology was there. So I usually prescribe the medicines for 21 days so that patient don't shift doctors again. Because there is a lot of doctor stopping all the time. Patients like to change the doctors for a better and faster results. But during the visit also, the patient condition was aggravated. He was severe itching. He was emotionally getting disturbed. There was an aggressive eruptions after so I asked the patient, I showed you my personal lump. Let us see when there is an aggravation, how severe it is going. So, despite repeated follow-ups, the case was not clear initially. The patient was speaking continuously about the same routine: cricket, studies, family responsibilities, financial conditions, college, this and that. So, it was, we were not getting, the patient was not seeing the case in a proper way. So, as I said, I have exchanged my number with the patient. So, I could see in his DP, Mother Mary's picture was noticed. Then I asked during the following consultation, how come your name stands Arun? Then you have recently visited some church and all that to get a DP with the Mother Mary. Then the patient was like, now the case has revealed to me. The patient said that I have born and brought up as a Hindu man, but when I was 5 years of age, I had very high fever. So my mother said that we will pray. My mother said that I prayed to Jesus to the church, and you got better. So you should follow the Jesus Christ. The patient said that. Then later, during my 10 years of age, as young boys, there was Ganesh festival going on. So again, I felt that there's so much of joy, happiness, and there is a lot of boyish things to do. So So again, I shifted and I started following Hinduism. Then again, when I was in 10th class, my father met with an accident. And again, my mother pressurized me that we should pray again to Jesus so that our health will improve. Then again, during my teenage, in 18, 19 years, again I was in love with a Hindu girl. So again, I started following Hinduism. He was like, bro, what you're up to? Then he was like, I'm also confused. So that's how the case has unrevealed with the number case. I said, your name is Arun and you visit recently. Then he said, during 5 years, we prayed and we shifted to Christianity. Then during adolescence, during Ganesh Puja, again I started Hindu practices. Then again 10th, my father met with an accident. Again, I believed in Christianity. Again, during teenage, I was affectionated towards a Hindu girl. Again, I shifted back to Hinduism. So it was like irresolution, confusion of identity, instability. There was fear, dependency, and relationships. There was a lot of confusion. And during the case also, when he was saying that there is a lot of financial struggle. The father works at a factory and mother works in a garment unit. And younger sister is studying, and I'm in college at studies, and I'm pursuing degree. But I have to quickly finish and support my family financially. During another session of the case, he was said that he is on a deeper inquiry, suppressed emotions started surfacing. The patient relieved the excessive masturbation associated with intense guilt and self-condemnation. He also carried suppressed anger within himself, but never expressed it openly. The anger, guilt, confusion, emotional instability appear deeply connected with the progression of is psoriasis. Chilly, severe itching in the scalp, refuse scaly, fleckiness, aggravation, emotional stress. Indecision, irresolution, confusion of identity, emotional instability, suppressed anger, guilt from masturbation. Anxiety about future and finances, strong sense of responsibility towards family, but still circular and indirect competition. So mind, indecision, irresolution, abuse elements from sexual aggravation, anger with guilt, I could get nausea. So nausea, when I have prescribed, the patient has been very much doing better, after which the psoriatic conditions have been improving. The scalp, the flakiness has reduced, the redness, the itching has reduced. Here the patient is doing much more better. So with this chronic psoriasis case is linked to unresolved emotional conflict, confusion of identity. I have taken there is a irresolution, confusion of identity, suppressed anger, hidden guilt, rather than just superficial skin disorder. So it is a case of this. This is one of the most near case to me, because this is a case of pediatric case of severe neurological degeneration with myopathy and myxoid astrocytoma. It's third ventricle cancer. So, myxoid astrocytoma is a rare, aggressive pediatric central nervous system tumor associated with poor prognosis, recurrence, hydrocephalic manifestation, and progressive neurological deterioration. So this girl gradually developed profound systemic and neurological decline following vaccination. Later was diagnosed with cancer. She was extremely catatonic state with severe development regression, recurrent convulsions, paralysis, and muscle wasting. The child is 1 year, 1 month. The case was taken from mother. So there was recurrent convulsions, projectile vomiting. Actually, this patient's mother is my patient. So the patient's mother was not coming to the clinic for the last 3-4 months. She was very irregular. On inquiry, then she said that her daughter is being diagnosed with this cancer, and she is not going to come to the clinic for coming 2 to 3 months because she got operated at Rainbow Hospital, Pediatric Rainbow Hospital in Bangalore, and they were given her 2 to 3 days of time for the survival, because there was failure of survival due to the condition. So the patient was actually healthy, but after surgery, she has become completely bedridden, and she got hospitalized, operated for 2 times. Hydrocephalus, severe tumor was there. Mother says that she was absolutely normal, even with the mother, the child used to accompany us to the clinic. After 6 months after vaccination, the mother says that the child started developing repeated vomiting episodes, marked weakness, inability to gain weight, and progressive loss of vitality. So despite of feeding well, she was becoming weaker, thinner, weight gain stopped, muscular progressive wasting became evident over the time. Child went Ayurvedic, allopathic for a long period, extensive treatment. Mother said that it was only skin and bones, almost complete loss of muscle tissue was there. She has undergone multiple neurosurgical interventions twice, repeated hospitalization, long-term anticonvulsant therapy, extensive Ayurvedic treatment, and prolonged allopathic treatment. So this was the condition the child visited. She even didn't visited my clinic. She was in the car. Me and my husband, Dr. Vishwas, we came out and saw the patient. They were taking her to the village because the Rainbow Hospital, the doctors have said that it is very difficult for survival. She has hardly 2 to 3 days. So from the little history and the reports what we have got, we have came to know that appetite is poor, and there is no thirst, sleep is disturbed due to convulsions, bowels are irregular, and perspiration is scanty. Marked dullness, vacant, fixed staring, lack of response, irritability, and disturbed. So complete absence of muscles, skin and bones. The patient was all around 2.2 kgs only when she was in the last stage of her clinic. So severe muscular wasting, progressive myopathy, reduced muscle bulk and weakness of all the limbs. So the brain MRI reported that recurrent pielomyxide astrocytoma involving third ventricular region with post-operative changes. Still the cancer was persisting. This astrocytoma involving the third ventricle resulted in raised intracranial pressure, projectile vomiting, convulsions, neurological suppression and developmental regression. So post-vaccinal onset, progressive wasting, neurological suppression, tumor tendency strongly corresponded to TUJA. Definitely we can think about it. So convulsions were recurrent, convulsions from brain disease, syphilitic miasm. We are given TUJA 200 one dose. In between, we had to repeat it. Convulsions and the vaccination elements from we have taken the rubric and we have given TUJA. There was a clear cut at that moment of stage where the patient had 2 to 3 days of survival. The case was not getting opened up from the parents because they were not in a condition to give exactly. The only thing we could see was skin and bones, and the TUJA vaccination was the causation. So after 15 days of the TUJA, the patient who was on rice tube started oral feeding. That was a great improvement. Convulsions reduced. There was improved sleep and vomitings also reduced. Appetite, weight gain increased in the muscle tone. So we can see the patient is now without rice tube, moving her hands, legs. Later she was sitting with the support. Her neck holding is not there. Later she came to our clinic. She started neck holding. She celebrated her second birthday with us. In my clinic, she came and she celebrated her second birthday there. So sitting, regained support, crawling started, vocalization improved. Definitely she's not as normal as other children. She is around 6 to 8 months behind her age. But definitely life is much more important than what we can say about milestones occurring. So now she's around 7.5 kgs. There was a neurological muscular developmental pathology after vaccination, and homeopathy is going to give life back. This is the case learning what we have seen, that homeopathy can do miracles. Vaccination, whatever it is, it can give us life back. This was a learning from this case. So considering post-vaccinal disturbance, deep asthmatic pathology, constitutional susceptibility, and long-standing degenerative pediatric illness. Patient is smiling, healthy, a little slow up to her milestones, but she is surviving. And when there was a survey by Rainbow Hospital where they have said that why you have not come and still collected the death certificate of the child. It was a call, they have called to the parents. Why you have not collected? Then they said that the girl is surviving and she is on a homeopathic treatment. The Rainbow surgeon, neurosurgeon called me and asked, Madam, why don't you give some fees to us so that we can help you us with the OP itself? So that was the case which is close to my heart. Next case is a case of alopecia areata with trichophagia. So this is also a teenage girl, 13 years, with patchy hair loss since 4 years. And she has a compulsive habit of pulling and eating her hairs. With the anxiety, she used to pull and eat her hairs. It was very disturbing. But the status of the case has started. She says that anxiety, emotional instability, irritability since her grandmother's illness. And there is disturbed sleep with fatigue, offensive perspiration, increased salivation, poor concentration, and memory weakness. So this was the condition of the girl. She is 13 years old. Every 15 days, she has to shave her head. Because there was if there are hairs, she will eat up. That's the reason parents every 15 days they used to shave her hairs. So that she will not feel at least ill. So she was apparently healthy up to 13 years of age. and her maternal grandmother was diagnosed with carcinoma. So she was very much deeply attached to her grandmother and profoundly affected by her illness and suffering. What we have taken, it is like your elders give you blessings, they touch your hair, they give you that love pampering, which she was missing when her grandmother was diagnosed with cancer. And her grandmother expired by 6 months when she was diagnosed with cancer. That emotional shock, the patchy hair loss, or we can see small bald patches appeared, which was slowly enlarging multiple over time. Hair fall became excessive, recurrent, and there was a compulsive tendency to pull her own hair during the period of anxiety and emotional disturbances. So definitely with this behavior, we can say irritability, emotional sensitivity to anxiety about grandmother's health, restlessness, internal tension, easily angered when questioned repeatedly, alternating sadness and irritability, difficulty expressing emotions openly, social withdrawal due to embarrassment regarding appearance. Same again, many applications, many treatments, many supplements with minimal or temporary relief. So there was no major illness in the childhood, no tuberculosis or epilepsy. Maternal grandmother was diagnosed with carcinoma. Elements from grief and prolonged emotional stress, anxiety regarding loved ones, irritability from questioning, emotional instability, restlessness with internal anxiety, and mood swings. Sensitive to emotional impressions, social withdrawal due to embarrassment, difficult concentrating, weak memory, compulsive behavior to eat and pee and eat her hairs. So appetite was normal, thirst increased, profuse perspiration and offensive. Offensive perspiration was there. Thermals where she was sensitive to both heat and cold, cannot tolerate the extremes. Sleep was disturbed, weakness and fatigue was there. With this physical and mental symptoms to the patient, psychophagia, anxiety and irritability. It's a psychosomatic autoimmune disorder precipitated by grief. So as we know, alopecia areata is an autoimmune inflammatory disorder characterized by non-scarring patchy hair loss caused by autoimmune destruction of anagen hair follicles. In this case, prolonged emotional stress and grief acted as a major maintaining cause and leading to psychoneuroimmunological dysregulation. So the chronic emotional stress can produce dysregulation of hypothalamic pituitary adrenal axis, altered cortisol secretions, immunoimbalance, autoimmune attack against hair follicles. It was a compulsive tendency towards psychophagia reflected underlying anxiety, emotional unrest, and disturbed coping mechanism. So the rubrics were taken. Mind impulse to and eat her hairs, social withdrawal. Case is syphilitic, but usually the rubrics what we get will be psychosis because we have to see then perspiration was offensive at night, salivation was increased, and emotional cause was there, weakness and fatigue was the thing. So it is a syphilitic with psoric background and chronic in case. So after grief, irritability, offensive perspiration, salivation, autoimmune, compulsive behavior tendency, Hmat sol was prescribed. Hmat sol was selected constitutional remedy for mental, physical, and pathological correspondence. Hair fall reduced, anxiety reduced, sleep improved, psychophagia frequency decreased. Patient started with few hairs, smiles back again, visible hair growth, reduction in irritability, better concentration, perspiration offensiveness was reduced, hair started growing more better. Then within 6 to 8 months, we can see trichophagia completely absent, weakness was completely absent, emotionally she was doing great. She was smiling, she was doing well. So this case connects us emotional trauma and autoimmune pathology. A prolonged grief associated with grandma's illness acted as a maintaining cause of psychological and physical disturbances. So there was a good hair growth. The patient has improved really well now. She is doing great. So this is the case of, this is the last case. This is a case of facial wart with deep emotional suppression treated with causticum. The patient came, entered into the clinic, said that she is having wart over the nose since many months. It was gradually increasing, but she was undergoing recurrent surgical excision. And definitely the wart over the face, over the nose, she was having facial disfigurement. Not done much to the case, just took nose, warts, causticum as a remedy. I said, let me try. Then it was like, as we know, in the case taking, she was similar to Kali. So Kali and causticum comes to the same family. I have given her causticum. And we know that recurrent wart over the nose is diagnosed as viral wart secondary to human papillomavirus. Infection small in size, gradually enlarged and become cosmetically disfiguring. So pandemic ended, but she was wearing still the mask, as you can see in this picture. She has undergone surgical excisions every 15 days, every 10 days. She wanted to get exhausted with that. She was not feeling good about it and she was sensitive. Also, ఏమైంది నీకేమైంది ఎందుకు మాస్క్ వేసుకుంటున్నారు ఇంకా ఇప్పుడు కరోనా లేదు కదా ఎందుకు వేసుకుంటున్నారు అనేసి జనాలు అడుగుతున్నారు అనేసి she was recurrently changing doctors. She was asking about she was like more sensitive towards so emotional suffering, weak overall, weak current we have taken. It's not managed. There was no significant family history, no lasting relief from the local treatment. Sensitive to criticism, emotional suppression, silent grief, low confidence, recurrent warts, recurrent excision. So we have to just not remove the wart, we have to treat her constitutionally so that her immune response will improve and underground chronic disposition is important. So we know it is psychotic miasm, overall growth, wart from recurrent tendency and chronic proliferative pathology. So we know boric, external nose tip eruptions, growth warts, causticum was there, face warts, nose tip, causticum is covering. Yeah, from Kent also causticum, nitric acid and thuja. From complete face warts, nose, we have again causticum covering with 4 marks and thuja also. So complete disappearance of the wart, no reoccurrence, significant emotional improvement, and patient is able to move without the mask. So there was, so after undergoing so many surgeries, also patient was not reporting, but after causticum 1 dose, she has recovered very beautifully. So these are the few cases which has given me a lot of confidence, which has the homeopathy can heal and do miracles and change lives of everyone. So I would like to thank my guru. So as we know, the case emphasizes holistically rolling homeopathy in treating both physical manifestations and deeper emotional dimensions of chronic diseases. So my guru, Dr. Pratik sir and Dr. Muralidhar sir, from whom I have learned homeopathy. I am in depth grateful to them. And thank you, Hmat, for giving me this opportunity. I am very much grateful to you. Thank you so much. Thank you for an enlightening and thought-provoking presentation. We are grateful for your valuable knowledge and clinical insights you have shared with us. We now move on to second academic session of the evening. To introduce our next speaker, I invite Dr. Harshita Vore to come on to the dais. Good evening. Now I am going to introduce our second speaker, Dr. Gautam Ralabandi, sir. Dr. Gautam Ralabandi completed his BHMS from JSP's Government Homeopathic Medical College in 2015 and went on to earn his MD in repertory from the same institution in 2022, and he secured a gold medal for his outstanding academic performance. With over a decade of clinical experience, Dr. Gautam has established himself as a dedicated practitioner, teacher, and organizer within the homeopathic fraternity. In recognition of his service to healthcare, he was honored with the Vaidya Seva Ratna Award by Elders Club International in 2022. He has also served as an assistant professor in the Department of Surgery and Repertory at Hamsa Homeopathic Medical College, contributing significantly to the academic development of aspiring homeopathic physicians. He is an active and committed member of our Homeopathic Medical Association of Telangana. He served as an executive committee member for 6 years, as a joint secretary for 3 years, and currently he holds the position of organizing secretary, playing a vital role in advancing professional and academic activities within our association. Today, his topic is clinical insights into lesser known homeopathic remedies. Please welcome sir with a round of applause. Thank you.
Good evening, everyone. At the outset, I would like to thank the Homeopathic Medical Association of Telangana for giving me such a great opportunity, for sharing my knowledge in the form of a small topic, clinical insights into lesser known homeopathic remedies. I was called by our General Secretary, sir, 2 days back for the opportunity I got today. So the topic I chose is lesser known homeopathic remedies because this has been my almost daily routine prescribing these remedies. So this is not a tough task for me, to be honest. So I just accumulated a small information of my daily routine, my clinical practice, and here I am with a presentation. So most of the practitioners like us, we prescribe the polycrust remedies like Lycopodium, Nux vomica, Pulsatilla. So these are the frequently prescribed remedies. However, there are many chronic and difficult cases where we fail to where they fail to respond completely. So which even I faced since 10 years of my practice. So the lesser known remedies, why I chose this topic is given awareness that they possess highly specific therapeutic affinities towards some of the conditions. And these remedies, they act like missing links in cases where well-known remedies only provide partial relief. To complete the action of that well-known remedies, these lesser-known remedies play a vital role. And of course, the knowledge of these remedies will broaden the physician's prescribing horizon also. Why to study these remedies exactly? They expand your medical knowledge, they improve accuracy in difficulty cases. Of course, they help in pathological prescription, provides alternatives when common remedies fail. So where to go when the most selected, the most indicated, or the common remedies which you come across in various type of repertorizations, where to go? So these are the aid or the the lesser known remedies which help us. They enhance the confidence in advanced clinical practice as well. So going into the topic proper, I classified the remedies to be discussed today into the sources according to their source. The first, plant kingdom. The remedies to be discussed, Cedar maker, Boswellia serrata, Sanguinaria nitrica, and Sumbul moschus. Coming to the animal kingdom, I would discuss E. serum, Serum angulae. Coming to the sarcode, I would discuss Pepsinum, Nosode, Calcarea renalis, a mineral chemical acetanilidum, and Infondibulia X-ray. So these are the remedies I'm going to discuss today. First, coming to the plant kingdom, and the first remedy, cedar maker. The source or the name of this particular, the source of this particular sedum acre is pepper plant, this wall pepper plant. Otherwise, it is called small house leek. That is the common name of this particular sedum acre. This belongs to the genus Sempervium. So the exact meaning of the word Sempervium is always living. So it survives in harsh atmosphere. So we can consider it as a doctrine of signature as well. The wallpaper or the sedum acre, this is hardly low maintenance succulent ground. It covers known for its fleshy green leaves and bright yellow star-shaped summer flowers. And it thrives in dry, rocky soils and full sunlight. It needs bright and full sunlight, which we are facing last 1.5 months. This is a perfect time for this plant to grow. And it belongs to the family Crosslaceae. And traditionally, this is known for its properties like irritant and caustic properties because of the presence of a compound called piperidin. It also has antioxidant properties based on its flavonoids and phenolic content. And it is anti-inflammatory because of the presence of ursolic acid and flavonoids. And the sphere of action of this particular remedy, sedum acre, is rectum, intestines, female pelvic organs, and mucous membranes. And the characteristic symptoms are gastrointestinal, chronic dysentery, frequent ineffective urging, bloody stools, burning pain in the rectum, and there is persistent tenesmus after stool. Of course, painful hemorrhoids, anal fissures, ulceration of the rectum as well. And female complaints like uterine prolapse, bearing down sensation, and menorrhagia. These are the characteristic symptoms of sedum acre. And when what I faced in my clinic, when aloes and nitric acid are frequently indicated for many of the cases. So these are the comparative points where I see tenesmus is severe in sedum acre. It is moderate in aloes and it is very painful in acid nitricum. Hemorrhoids, ulcerative hemorrhoids in sedum acre. In aloes, as we all know, prolapsing, hemorrhoids, nitric acid, fissure. The stool is bloody in sedum acre. It is jelly-like in aloes and it is associated with splinter-like pains in nitric acid. So often when aloes and nitric acid did not give much relief to the patient even after repeated prescriptions, I found relief with sedum acre. The patients were much happier with this particular remedy. So the clinical insight which we can take from this particular thing, we can think of sedum acre when the tenesmus and rectal soreness is persistent despite treatments, continuous treatment. So this is a valuable remedy for chronic rectal pathology. As discussed earlier, it is characterized by persistent tenesmus. The next remedy we'll discuss is Boswellia serrata, Indian frankincense source. This is widely used in Ayurvedic system of practice. This is nothing but an oleogum resin. So the main source, the part used is gum resin, and it contains 30% of boswellic acid. And the structure of boswellic acid is active pentacyclic triterpene carbolic acid. And this particular structure is responsible for its anti-inflammatory action, antioxidant action, and immunomodulatory properties. So this particular content of boswellic acid in this Boswellia serrata, it suppresses the synthesis of pro-inflammatory mediators. So they block the leukotriene formation, which is responsible for cell infiltration, which is of course inflammatory, allergic responses and hyperactive responses. Antioxidant activity of this particular drug is due to the chemical structure, which scavenges nitrogen species and reactive oxygen. So that it protects from lipid peroxidation. That is how it helps. Coming to the sphere of action of this particular remedy, it acts mostly on joints, ligaments, synovial membranes, and connective tissue, where we predominantly see inflammatory pathology. The key symptoms: stiffness of joint, pain on initial movement like that of russtox, swelling, and restricted mobility. So likewise, it is used in the conditions like osteoarthritis of knee and hip joint, cervical spondylosis, rheumatoid arthritis, stiffness in the back. The clinical insight we can take from this particular remedy: useful when pathology predominates the inflammatory degeneration. So when you see the inflammation, considering the point of pathological general by Dr. Boger, when the inflammation runs in the particular patient, you can think of Boswellia. Often considered in elderly patients with chronic joint disease, and this has helped me really well in at least last 3 years of my practice. I've been using this remedy, Boswellia serrata, very effectively. The next remedy, the plant kingdom, I would discuss is Sanguinaria nitrica. This is nitrate derivative, which is an alkaloid of Sanguinaria canadensis, which we regularly use. And the particular property of this alkaloid is it has DNA intercalation property, where the cellular replication and transcription pathways are moderate. So it can get attached to a DNA. This particular alkaloid, it can get attached to a DNA structure directly, and it can alter its modulation. So it has a great role to play. The enzyme and signal pathways modulation also, especially of the inflammatory mediation. And it induces apoptosis, which is nothing but a programmed cell death. Especially in human cancer cell lines, there has been an extensive research on this particular alkaloid, Sanguinaria nitrica, on cancer cells. So this is a particular remedy we need to concentrate on. The sphere of action, homeopathically, considering the sphere of action, it works on nose, sinus, upper respiratory tract, and the characteristic features: there is profuse watery discharge, sneezing, nasal obstruction, frontal headache, burning sensation, and post-nasal drip. So recurrent sinusitis, hay fever, nasal polyps, and we can think of sanguinaria when chronic allergies in chronic allergy patients who repeatedly require acute prescription. So there are many patients that, at least in my practice, even after prescribing, after taking the case for long hours, considering the repertorization, prescribing good remedies, they come back with acute attacks. So that is when Sanguinaria nitrica has been a great help for me. The next remedy is Sumbul moschus. The source Spirula sumbul is otherwise known as musk root. The sphere of action of this particular remedy is nervous system, female reproductive system. And this remedy is of a great value for psychosomatic disorders, where the emotional symptoms dominate. So we can think of Sumbul. So there is nervous excitement, emotional instability, easily startled, hysterical manifestations, functional nervous complaints. We can think in clinical conditions like anxiety disorders, oversensitivity, emotionally, nervous palpitation, menopause, hot flushes, emotional liability, etc. So as discussed, for psychosomatic disorders, this remedy works like a wonder. But apart from all this, in my clinical practice, I would prescribe Sumbul for various dyslipidemia cases, and it has given an excellent result, along with Allium ursinum. There's a mother tincture, Allium ursinum. Along with that, when I prescribed Sumbul, it has given a tremendous good results for dyslipidemia. So next, moving on to the animal kingdom, eel serum, serum angulae. The source is blood serum of eel. And when I first read about this remedy, I started, researching. That is a habit I've got into since my internship days. So whenever I read a remedy, whenever I come across a new remedy, I would definitely search for its pharmacological action, knowing its toxicology, etc. So that is how I learned about this remedy eel serum. This contains ANP. You are aware of ANP, right? What is ANP? Atrial natriuretic peptide, a substance that prevents reabsorption of sodium from urine. So this particular eel serum, it contains potency of ANP, a good amount of ANP, which is 100 times greater than that of human iron. That is how it helps in which conditions? Renal conditions, obviously. Exactly. So this was introduced by H.C. Allen first. Dr. H.C. Allen later developed clinically. The sphere of action is, of course, kidneys and cardiovascular system. In boric, you can come across eel serum written in attenuations, typically made with glycerin or distilled water because it reacts with alcohol, ether, and other etc. like these substances. So it is specifically made with glycerin or distilled water only. And lower potencies like 1x to 3x are mostly indicated in heart conditions, and the higher potencies are suggested by Boric, Murphy, and different authors. The centesimal potency is 1C, 12C, 6C, 12C, 30C. It is frequently indicated for renal conditions. So the keynotes: marked decrease in urine quantity, suppressed urine, acute nephritis, chronic nephritis, and renal insufficiency. These are the clinical conditions, clinical applications, you can say: acute glomerulonephritis, cardiorenal syndrome, or nephrotic states. This is where these remedies indicated. Perhaps one of the most important, lesser known remedies in renal pathology, I would say, this particular remedy, eel serum. And you can compare eel serum with digitalis. It is given in boric as well. There is edema in digitalis, there is no edema in eel serum. This is the only difference. Otherwise, they suit to the condition very perfectly. So when the kidney function is rapidly deteriorating, please think of eel serum. It will be very handy. And I can, a small case, I remember a 52-year-old male patient who was a bus driver, of travels bus, private travels bus. So he's a known case of diabetes, CKD, nephrotic syndrome, diabetic nephropathy. Later, he had experienced angina while he was driving. Just imagine, he was driving a private travel bus around night 2 to 3 a.m. He experienced unstable angina, and this was twice, not once. And he came to me. Of course, he came to me at OPD at Hamsa Homeopathy Medical College while I was teaching there. So he's my patient now. Today morning also, I've seen this case. He came back for the follow-up as well. So he had this coronary artery disease with unstable angina, and his creatinine has been constantly high since last 1 year. Specifically, he's my patient since last 2 years. Is not coming regularly because of his occupation and financial distress. So his creatinine has been constantly high since past 1 year. It has been ranging from 4.5 to 6. So in December, it went up to 10.2 in December 2025. So that is when I introduced eel serum in my prescription to this particular patient, and it came down to 6.2 within a span of 40 days. And later, and again, in a span of 20 days, it came down to 4.3. It's still on medicine now. So this is how it helped, eel serum. And there are many cases of renal condition, especially diabetic nephropathy, nephrotic syndrome, where this remedy has particularly helped me. The next remedy to discuss is pepsinum, a sarcode. We are aware of it, which is a digestive enzyme pepsin. Of course, the action is on stomach and digestion. So gastric disorders, food remains undigested. There is heaviness after meals, gastric weakness, dyspepsia, flatulence, sour erectations, of course. The clinical uses functional dyspepsia, chronic indigestion, gastric atony, and postprandial distress syndrome. So this particular condition, the syndrome, postprandial distress syndrome, where the patient is having easy satiety. Many of the patients we come across give this symptom, easy satiety. There is fullness, bloated sensation of the abdomen. And many a times when I took case of these individuals, there was always lycopodium in the first place after repatriation. So when lycopodium did not give much relief to the patient, when I gave pepsinum, it has given complete relief. So where the chief pathology is deficient digestive power, think of pepsinum. The next remedy, the nosode calcarea renalis. This is prepared from renal calculus material. I've been using this remedy since last 1.5 years only. The sphere of action, kidneys, ureters, urinary tract. So there is recurrent renal stones, renal colic, urinary irritation, stone forming tendency. So this remedy particularly removes the stone forming tendency like calcarea carp. So there is recurrent nephrolithiasis, calcium oxalate stones, family history of stones, chronic stone formers. This acts as an important anti-miasmatic remedy in recurrent stone formation. Useful as intercurrent remedy with when the constitutional remedy fails, to prevent the recurrence. And here I remember another case. In fact, there are at least 14 cases which I've treated in the last 1 year to 10 months span, where I've seen very good results, sometimes rapid results, prescribing calcarea renalis. So there was a junior of mine who is not practicing homeopathy. She's working in an allopathy hospital. She suddenly came to my clinic, sir. I'm experiencing this dysuria since last 8 months. I've been taking all these medicines. I'm a duty doctor in the hospital, but I'm not able to give my full efforts there. There's a family history of stone formation. There's frequent tendency. Since my teenage, I've been experiencing this complaint. So prescribed, after taking the case, I prescribed the regular remedies like Lycopodium berberis vulgaris, mother tincture form, hydrangea mother tincture form. There was only slight relief. She was having on ultrasound. There was a 6 mm calculus, 7 mm calculus, and 4 mm calculus bilaterally. So when I prescribed calcarea renalis 3x form, in 3x form, along with a remedy, another rare remedy, Epigia repens. So there is another rare remedy called Epigia repens, which is frequently indicated for, stone formation. In combination, I've given this 2 remedies, and she came back after 3 days with the stone, carrying the stone in a small container. She came back only 3 days after I prescribed these remedies. So that is how rapidly our remedies work, especially these lesser known remedies is a topic which we are discussing. The next remedy, the mineral or chemical kingdom, acetamylida. It is synthetically prepared from acetamylide, which was originally a antipyretic. So later it was banned due to its toxicity. It was having high toxic properties. It is still used in dye industries, coloring industries, this particular chemical acetamylide. But the extract from it, we can use it homeopathically. The sphere of action, nervous system, circulation, and blood. And the characteristic symptoms which you come across of this particular remedy, especially in boric, you can go through, of eyes. So there is pallor of optic discs, contracted visual field, shrinking retinal vessels, and a condition called mydriasis. What is mydriasis? This is persistent and abnormal dilatation of the pupil. So there is persistent and abnormal dilatation of the pupil. The pupil doesn't get contracted or even, in the dark, in the light, it remains the same. So this is a particular condition, mydriasis. There is severe headache, neuralgic pains, along with this, the prostration, cyanosis, etc. The clinical insight So think of astanilidum when weakness is disproportionately greater than the pathology. Whatever the pathology is, when the weakness is disproportionately greater than the pathology, you can think of acetanilidum. And here I want to discuss two of the cases which are very interesting. A case of 40-year-old male patient who's an IT employee. He came to a clinic with haziness in center of the visual field of the left eye. There were also black spots seen. There's blurred vision on the left side. Ophthalmologist, he diagnosed him with papilla edema. There was macular degeneration. And that is when, after consulting an ophthalmologist, because their family uses homeopathic medicine, they came to us and whether we can help with this or not. So we were ready with astanilidum. So I prescribed astanilidum 6C along with carbonium sulf and thiocinaminum. Thiocinaminum 6C, you can go through boric materia medica. There is opacities of cornea. There's a particular point called opacities of cornea. You can definitely go through, come across this remedy. So this was given for 2 months at stretch. This particular remedies in combination, astanilidum 6C, carbonium sulf, and thiocinaminum 6C, all in 6C potencies. After 4 months, the patient came back. The blurring of vision decreased. The black spots gone completely. Haziness in the visual field decreased to almost 90-95%. It is still remained, it is not gone completely. He visited an ophthalmologist meanwhile, and he said the papilla edema is gone completely. He was not taking any steroids or not on any eye drops, etc. He was only given this particular remedies, and this is how the results are. So the papilla edema is gone completely, and just in a span of 4 months. A second case, one of my closest family members has faced this situation. She developed sudden headache with dark spot in center of the nasal visual field of the left eye again. On consulting an ophthalmologist, they revealed that it is an early stage of cataract along with papilla edema, grade 3. Additionally, there was loss of color vision. She was not able to identify or make a difference of few of the colors. This is what they diagnosed. Later, she was sent to a neurologist for evaluation. There could be something else, the root cause. The neurologist advised some of the investigations. She underwent investigations. Her homocysteine was high. Her vitamin B12 was low. On MRI of brain and orbits, there was this subtle asymmetric rim of enhancement in the left cavernous sinus. In the left cavernous sinus, there was this enhancement which was asymmetric and there was enhancement over the optic nerve sheath as well. So that is the reason in the left cavernous sinus and in the optic nerve sheath, there was an enhancement which is probably pressing, slight pressure. That is how our visual disturbance she was facing. And this nerve sheath, this was getting compressed at particular orbital apex. Of course, this was inflammatory in nature, diagnosed by neurologist as well. Her CSF showed little rise of WBC. Her BP was fluctuating. Of course, the intraocular pressure, the papilla edema grade 3. She was advised immediately Omnacort 40 mg daily. So she was given every day 40 mg Omnacort. Later, we started a treatment, astanilidum 6C. Of course, we also added arnica and carbonium sulf to the particular remedy. And this was prescribed on 4th of July, 2025. Just at the end of 5 months, again, she went to neurologist, ophthalmologist. Her disc edema was completely resolved. Of course, she was on steroid as well, the Omnicort. They said it only helps to, stop the deterioration. Otherwise, it will not help to bring it back to the normal state. So that is how our remedy helps. Astanilidum, arnica, and carbonium sulf have helped. The steroid was stopped in 3 months gradually. It was tapered down the dosage. The loss of color vision was completely resolved. Okay, she could differentiate. She's able to differentiate all the colors again. And there is, some partial defect on examination, and they said that will also go. So we can continue our medicine few more days. And the neurologist and ophthalmologist were shocked. So what are you giving? What are you using? They said, my family member is an homeopathy doctor, and this is what he prescribed, and this is how I am today. So that was a small story. There were 2 cases which I treated with astagalidine. The next remedy to be discussed, X-ray in ponderbilia. Potentized X-ray radiation. Many of the senior practitioners know this. So the sphere of action is skin, hair follicles, glands, bone marrow. The key symptoms: dry, rough skin, chronic eczema, psoriasis, alopecia areata, excessive hair fall. And the tissue changes, there is delayed healing and keloid formation like that of thyrosinamina. This is the same similar points, similar symptoms we see come across in thyrosinamina as well. The clinical insight from this: one of the most frequently used in ponderbilia in dermatological practice, and often prescribed when well-selected remedy fails. So this was in the year 2018 when I first treated, when I used X-ray in my practice. There was this 19-year-old patient, female patient with palmoplantar psoriasis. She was given, after taking case number of times, phosphorus was prescribed, which is a specific for palmoplantar psoriasis as well, along with arsenic album. There was only 60 to 70% relief every time I repeated the remedy. It was not going completely. So that is when I gave X-ray in 6C potency. And within a span of 1.5 months, the rest of the eruption, the scales were gone completely. And she's happy now. No recurrence of the condition. And she was anemic too, along with the palmoplantar psoriasis. That is when it struck me, because X-ray also is indicated for anemia. So it frequently indicates for skin conditions, various chronic skin conditions, and male sexual complaints as well. So there are many other rare remedies which I use in particular in my practice, like Borrelia diffusa, which is otherwise the common name Punarnava in Ayurveda, which is a strong diuretic and tonic for dropsy. So when there is swelling in the knee joints, lower limbs, especially with renal condition, I would definitely prescribe Borrelia diffusa in mother tincture form. There's another remedy called chloralin, which is frequently indicated for urticaria. A remedy called Copaiba, chronic urticaria in children. And there is a specific point regarding urticaria here is the hives are always associated with fever in Copaiba. And it is also indicated for urinary conditions as well. There's frequently used remedy called Fagopyrum, which I use at my clinic for pruritus, especially penile pruritus, itching in old age. The Epigia repens, which I already discussed. There's another remedy called Prunus spinosa, indicated for migraines. The remedies which I use frequently, of course, the indicated remedies: Chionanthus, sanguinaria, belladonna, glonine, gelsemium for migraine. When they fail to give complete relief, I go for Prunus spinosa, which helps me every time. There is severe migraine with eye pain and neuralgic dysuria in Prunus spinosa. There's another remedy called Embolica officinalis, which is otherwise amla. This is a high antioxidant. It helps in digestion, cardiac diseases, cardiac conditions, metabolism. It improves metabolic actions, etc. There's another remedy called Vitex nigundo, which I frequently prescribe my clinic. There's especially given what I prescribe is for increasing hemoglobin. And it does within a span of 2 weeks. I've seen good results almost in 70 to 80% of my cases where I prescribe for hemoglobin. To increase the hemoglobin, I've found good results with Vitex nigundo. And this is again in the mother tincture form. The take home message from this particular discussion, the pathology based prescribing can be highly effective when guided by symptom similarity. Of course, that has to be there in homeopathy. So the lesser known remedies, they often bridge gaps left by the constitutional treatment. So not every constitutional remedy which we get after repatriation, after case taking, many a times we get complete relief. We will give complete relief to the patient. So that is when these remedies help. The remedies like eel serum, calcarea renalis, X-ray, these are especially valuable in modern clinical practice, the conditions which we already discussed. So coming to the knowledge of this particular rare remedies, they improve our success in difficult cases. The physician who only knows polygus limits his therapeutic possibilities. So these therapeutics, what I discussed today, these are only after reading, many a times going through Boric, Lilienthal therapeutics, etc. Books like this, this literature helps you very much. Of course, under the able guidance of my guru, Dr. Venugopal Gauri sir, has always guided me in my practice. It's been more than 10 years that I've been associated with him and the association simultaneously. So that is how it is helping me in practice, and I'm very happy practicing homeopathy. And so this isn't only, this information is not in the textbooks. This is from chairside insights, I would say, not bedside. Chairside insights, I would mention that. And conclusion, Materia Medica is a vast ocean. So every lesser known remedy represents an undiscovered island waiting to help a patient. This is what I learned from going through this particular conditions. Thank you very much. At the outset, I would like to thank the association for giving me such a great opportunity. President Dr. Gopal Krishna sir, General Secretary Dr. Durga Prasad sir, all the senior practitioners, Dr. Kalpana ma'am, Dr. Manik Prabhu sir, my teachers, my colleagues, my ex-colleagues, Dr. Leela ma'am, my students who have pushed me in learning day to day to keep updated myself. And of course, I would thank my patients, without whom we would not discuss such great points today. I would like to thank my patients as well. Thank you very much, everyone, for giving me this opportunity.
Thank you, sir, for an excellent presentation. Your clinical experiences and practical insights into lesser known remedies have undoubtedly broadened our understanding and prescribing horizons. Knowledge shared is knowledge multiplied. As a token of our appreciation and gratitude, we shall now honor our esteemed speakers for their valuable contribution to this memorial oration. I request Dr. Gopal Krishna sir, President of our association, to come on to the dais. I request Durga Prasad sir to come on to the dais. I request Dr. Manik Prabhu sir, Vice President of our association, to come on to the dais. I request Dr. Vishwas Reddy sir to come on to the dais. Before proceeding to the felicitation, I request anyone, if they have any doubts from two sessions, please, we'll hand over the mic to you. Uh, Ma'am, the potency selection was usually for my skin conditions, I usually go for 10M. The conditions is, if it is syphilitic condition, I have majorly seen that 10M potency is very much helpful, and I wait for 21 days. That's my formula, what I have seen very successfully in my cases. With the 10M potency and 21 days, usually if there is a good improvement in the case and with the physical generals, mental generals, if there is improvement, then I'll wait for further improvement, or else there will be a repetition once in 3 months or 4 months for the progress to go ahead. Only in the first case for sepia, I have given 200 potency. That was on Sunday, and my practice was very much rushed on that day. So I had around 18 to 20 patients. So it was very haphazardly. I was sure it was sepia with the case, but the potency I missed it and 200, but it worked very well. So I am thankful for that also. That's it.
Thank you, ma'am. I request as first speaker, Dr. Akanksha Reddy, ma'am, to come on to the dais for the felicitation. Thank you, ma'am. I request our second speaker, Dr. Gautam sir, to accept our felicitation. Congratulations and thank you once again to both our distinguished speakers. On behalf of HMAT, I extend my sincere gratitude to our esteemed speakers, Dr. Akanksha ma'am and Dr. Gautam sir, for their insightful and enriching presentations. I also thank our HMAT leadership, organizing committee, and support staff for making this event a grand success. Our heartfelt appreciation goes to all the dignitaries, practitioners, students, and participants who joined us today both offline and online. May the legacy of Sri Nyapati Venkata Srinivas Rao Garu continue to inspire us in our pursuit of excellence in homeopathy. Thank you all for your valuable presence and participation. As we come to the conclusion of this memorial evening, I request everyone to kindly stand up for the national anthem.